Greetings. I will be doing my presentation on the ethical and legal issues surrounding telehealth. Telehealth has rapidly transformed healthcare by allowing patients and providers to interact remotely using digital technologies. While this innovation improves access, efficiency, and patient outcome, it also introduces complex ethical and legal challenges. For instance, telehealth falls under the broader category of health information technology that requires very meticulous consideration of privacy, security, and the quality of care, which can impact the outcome of care delivery. While the legal concerns focuses on the regulatory compliance and liability. So, during this presentation, I am going to examine the ethical consideration, legal framework, and the implication of social media in the field of nursing practice. Ethical principles such as autonomy, beneficence, non maleficence, and justice guide telehealth practices. One major concern is patient privacy and confidentiality. As telehealth platform transmit sensitive data electronically, there is increased risk for breach of security. Another issue is equity of access. While telehealth improve access to many, it has disadvantages in that to those who lack internet access, it is not feasible for them. Ethical practices also require us to obtain informed consent as providers, ensuring that the patient understands the limitation and the risks of telehealth, including potential and failure of privacy concerns. What are some of the legal and regulatory issues around telehealth? Telehealth is governed by multiple legal frameworks at the federal and state level. The most significant is HIPAA, which mandates protection of patient health information and secure transmission of electronic data. Healthcare providers must ensure that telehealth platforms comply with HIPAA requirements, including encryption, secure access, and proper handling of protected health information. Additionally, providers must consider most state licensures across their state board. Legal concerns also include malpractice liability. As providers, we are held to some standards of care. Failure to meet these standards due to technological limitation or miscommunication can result in legal consequences. In addition, there are new state privacies and federal enforcement actions that highlight the importance of safeguarding patients' data, especially when third party technologies are involved. When we tend to look at social media, healthcare providers increasingly use social media and digital communication tools, but this platform introduces legal and ethical risk. Nurses must avoid sharing any identifiable patient information as it violates HIPAA and professional ethical standards. Even unintentional disclosure, such as discussing patient scenarios or post images, can lead to disciplinary action. For instance, those in the mental health field, we have situations where people are been known to discuss their patients in elevators or in the hallway or follow patients on social media, Facebook, TikTok. They are all breaches of patient confidentiality. Social media also raises concerns about misinformation, professional credibility, and maintaining patient trust. As nurses, advanced practice nurses, we must ensure that any information shared is accurate, is evidence based, and is compliant based on the regular regulations that guide us. Without any further ado, telehealth presents significant ethical and legal challenges related to privacy, access, and quality of care. Key legal frameworks such as HIPAA and state licensure laws are essential in protecting patient data and ensuring practice safety. In conclusion, the use of social media requires strict adherence to every ethical and legal standards to prevent violation of patient safety and privacy, which can further affect the need for treatment. To address these challenges, healthcare organizers and professionals should implement secure technology, provide ongoing training, and establish clear policies for telehealth and social media use. By prioritizing ethical principles and legal compliance, us as professional nurses, us as advanced practice nurses, can effectively deliver patient care which evolve digital healthcare landscape. Thank you.